strong focus on female health and female aging. So with this, I will present GlycanAge and GenA's work that has been made in the field of glycobiology. And first, I need to talk a little bit about what glycans are. So even though people generally know about glycans as carbohydrates, they're a bit less familiar with the scientific term for carbohydrates, which is glycans. And they are basically one of four basic building blocks of life, together with nucleic acids, proteins, lipins, and lipids. So when you imagine your cell has all of these components, but while typically we imagine the cell membrane just as this thin layer of lipids, in reality, our cells are coated with both proteins and glycoproteins, and they have a very, very thick coating of glycans. So glycans are essential. They're basically, without glycans, we would not be able to survive. When we talk about specific type of glycans that are attached to the immunoglobulin G, those are N-glycans. And these glycans are branch structures composed of different building blocks, and the most complex form of the IgG N-glycan is presented here. And you can see that these building blocks can be added or omitted in different structures. And the most anti-inflammatory glycans have these additional extensions of galactose and the sialic acid. So when we talk about immunoglobulin G glycosylation, what you can see is that the glycans on top of the immunoglobulin G are bound here in this central cavity of the immunoglobulin FC region. And why is this important? It is important because they are acting in the structure and function of the immunoglobulin G. So by simple change of the type of glycan attached, you can change the size and the shape of this central cavity, which is also a binding spot for many different molecules and receptors of the different cells of the immune system. So by a simple change of glycans, you can change the reactivity of your immune system, and you can switch it from the more pro-inflammatory to the more anti-inflammatory action. So when we talk about IgG glycans, and IgG is the most prevalent antibody in human blood, every person has a profile, so a mixture of over 30 different glycan structures bound to their IgG molecules. And this profile typically looks something like that, but every single person will have a little bit different size of these peaks that are represented by specific structures within them. What we learned in the past, and this was work published in 2014, actually the preprint of this paper was already online in 2013, and this was exactly on the same date when epigenetic markers, Horvath biomarker of aging was presented. We saw that glycans are an exceptional marker of chronological and biological ages. So when we looked at these different profiles of immunoglobulin G within the population, what the authors of this study saw was that basically, if you simply align this population from younger age to the older age, what you would see is that this ratio of different glycan structures is changed with their chronological age. However, there was, a lot of the variation, and what also authors saw in this paper was that the variation within this profile associated with biomarkers, other biomarkers of inflammation, which was, for instance, cholesterol and other measures such as BMI, waist circumference, and so on and so on. So a theory behind it, why we believe this happens, is something that is called inflammaging. So as we are aging, the very early adulthood, our immune system is basically mature. It is ready to face any sort of dangers from the outside world. And we typically, in this very early adulthood, which is somewhere around the early 20s in this sense, we basically have a large ratio of these longer anti-inflammatory glycans bound to our immunoglobulin G. So the size here represents the relative ratio present within the blood. However, as we are aging already, in this middle aged group and in the elderly population, we can see that this ratio is slowly shifting towards these shorter glycans, and then more and more switching towards these more shorter glycans, which are acting as pro-inflammatory glycans. One of the possible reasons why this is so is because throughout the lifetime we are exposed to multiple issues. We're exposed to pathogens, we're exposed to bacteria, viruses, to any sort of damage happening within our cells, DNA damage, any sort of metabolic issues, and all of these things need to be repaired by our immune system. And then every time our immune system is activated throughout our lifetime, it needs to switch into this pro-inflammatory state acutely. And this acute switch towards a pro-inflammatory state is, in essence, a good thing. We need it in order to keep healthy. However, after the danger is eliminated, after the damage is eliminated, we need to go back to the anti-inflammatory state. And this returning towards the anti-inflammatory state is getting less and less efficient as we're aging and going towards the elderly state. However, not every person is aging at the same speed. What we saw is that IgG glycans are actually very good in prediction of cardiometabolic conditions. So people who had higher pro-inflammatory glycans at a younger age had a much higher incidence of any cardiometabolic diseases, which are typically occurring later in the lifetime. And, people who had younger anti-inflammatory glycans, they also had a much less of the cardiometabolic conditions and states. And what we saw is that basically the IgG glycans were excellent in prediction of diseases such as diabetes type 2, and which is very interesting. We have one single glycan structure which is excellent in prediction of cardiovascular diseases for women. There was another study which was published not by our group but by others, and there they basically showed that among the comparison of many different biomarkers of aging, actually the biomarker of the IgG glycans which we are using were best at predicting future hospitalizations, so hospitalizations related to age-associated health. What I need to tell you now is that women and men actually don't age the same. So women and men have different curves of aging. Now, I told you before that we have this pro-inflammatory and we have these anti-inflammatory glycans. So here, these two groups at the top are pro-inflammatory glycans, these GP4 and GP6. And these are four different groups of people that we used in the research. And what we saw is that basically this blue line is men and this red or pink line is women. And while men have typically more linear aging curves, so increase of these pro-inflammatory glycans, women tend to have a sharp increase in the amount of pro-inflammatory glycans around the ages 40 or 50. Very similarly, but of course in a different direction, this was also the case for the anti-inflammatory glycans. So while men tended to have a more linear aging curve, women typically had also this sharp decrease in the amount of anti-inflammatory glycans around the age, between the ages 40 and 50. So of course, the first clue when we saw that was this is exactly the age of menopause. And exactly around this age of menopause, women see a sharp uptick in chronic inflammation and biological aging. And of course, one of the main clues what could be going on here is the estrogen levels, decline of sex hormones with lifetime that causes a hormonal imbalance. So between the ages 40 and 50, there is a sharp drop in estrogen level. So our question was, can we actually use IgG glycan as a biomarker of deteriorating cardiometabolic health associated with menopause? And the existing issue is that globally, the indirect cost of menopause-related productivity losses is estimated at $150 billion, with the direct costs of 198 pounds per patient per year. And the effect of perimenopause and its mismanagement is actually felt at a societal level. So here there is a statistics for NHS where 71% of perimenopausal and menopausal women take time off work to attend up to 7 GP appointments, with 20% of women leaving jobs due to the consequence of the issues that they feel around the menopause. And of course, this is statistics for the Great Britain, but this is a widely present issue. There are very similar statistics for many countries around the world. And 58% of the women in UK can't access menopause services locally, and this percentage is actually even much higher in less developed countries. Moreover, what we see now as the average age that humans live up to is that women tend to spend 30 to 40% of their lifetime in a postmenopausal state. So it is clear that if there is a cardiometabolic issue, and I will show you today a very strong data indicating that it's associated with menopause and perimenopause, what can we do about it? And one of the answers is that we need to start detecting this perimenopause earlier. So what is perimenopause? When I say menopause, a lot of the people actually think that menopause is the time when you lose the cycle. In reality, menopause is when women have not had a cycle for a full year. Only then can menopause be diagnosed. But actually, years and years before menopause is diagnosed, women can have on regular cycles. They can go months without having a cycle, even up to 6 months, and then have a single cycle, and that means that they're not going to be diagnosed with a menopause until a year after. And this can go on and on for years. This can go for 4 to 10, even 15 years throughout their lifetime, that they're actually experiencing effects of hormone decrease, and that their health is starting to deteriorate. And you can see that even though the daily levels are fluctuating, what is happening with a geometric mean is that the levels of female sex hormones are actually steadily dropping years before the menopause is diagnosed, and also afterwards. Now, a lot of the times we're facing the issue that people think, when we say menopause, this is something very natural, this is something that is going to occur anyhow, and this does not possess a problem. And we're saying no to that. The health effects of perimenopause and menopause are a big issue. Why? Because perimenopause and menopause and postmenopause are actually associated with a decrease in sex hormones that have a large protective function within not only immune system, but the entirety of female metabolism. So during the early perimenopause, already the shifting hormone levels can affect the cardiovascular disease risk factors. And especially in the late perimenopause period, and as I told you before, this perimenopause can last up to several years, up to even longer than a decade. What is typically saw is an increase in the fat mass, decrease in muscle mass, the extra energy expenditure. So the women are often, even if they're not experiencing symptoms such as lack of sleep or anything obvious, their metabolism is already changing, and the insulin resistance can occur, and so on and so on. And what we saw is that just together with these health effects that are occurring, we also can see the IgG glycan transition from premenopause to menopause. We can see this sharp shift between anti-inflammatory and pro-inflammatory glycans. And this has been published this year. So we basically showed that this difference in the pro-inflammatory and anti-inflammatory glycans is tightly connected to the menopause. And we can basically now, depending on the speed of aging, we can create and generate formulas that help us basically predict menopause. And we can use this knowledge, and we can use these predictive effects to determine the health effects of the perimenopause. So the results from a meta-analysis, this was not done by us, this was by other groups, and this was a huge meta-analysis that looked at a large number of papers, and they saw that menopause before age of 50 was associated with 25% increased risk of cardiovascular diseases, that the estrogen deficiency may play a role in ischemic stroke, and that studies consistently show that women are more functionally impaired after stroke and less likely to receive tissue plasminogen activator compared with men. And in the meta-analysis, the odds of having a diagnosis of major depression as measured by a structured clinical interview increased 1.9 times in perimenopause and 4.3 times in postmenopause compared to premenopause. Now, when we come to, tackling this issue, now that I showed you that we have a biomarker for this deteriorating health around the time of the perimenopause and menopause, of course, there is an existing gold standard to treat a hormone decrease and the treatment for menopause, and this is hormone therapy, right? The HRT. Can we actually now use IgG glycan in optimization and sometimes maybe even in prediction for hormone therapy optimization? Now, this is the issue that we're currently dealing with, something that we're asking. We have several studies ongoing. We have several clinical studies ongoing, but I'm going to show you what we've done so far. And what we saw is that hormonal manipulation changes GlycanAge. Now, when we talk about GlycanAge, this is a name for the biological age as determined by IgG glycans that I showed you before. And basically, what we see is that decrease in sex hormones is followed by an increase in biological age. However, when in this study, women were artificially put into a menopause-like state, if they received estradiol instead of placebo, they were 9 years younger. So women who were in this artificial menopause, they were on average 9 years older, but when they were treated with the estradiol, then they would basically, their age would stay at the baseline. Moreover, if later on, when they were recovered from this artificial menopause, when their cycles were restored, what was noticed is that basically their biological age would again go down. So these 9 years would be basically reduced to the baseline. So in this paper, a colleague of ours directly showed that simply by hormonal manipulation, so through the hormonal therapy, this effect on the biological age can be indeed reversed. That this is really, working also on the real people, I can show you through several anonymous clients that we had. So we were tracking this one client for several years. And around the time between her 51 and 52 years, she started experiencing a sharp uptick in her biological age. So she went from the age of 29 biological years to the age of 58 biological years. So her estrogen levels changed significantly. And she experienced a very fast pace of biological aging. And when she noticed this change, and especially that this continued throughout this same year, she then followed up, within a couple of months. She spoke to one of our experts, and she went into the HRT, and we're continuing to follow her and to see what effect it's going to have on her biological age. We have here women that actually had a decent GlycanAge, even though she had a very, very healthy lifestyle, but she was at the age at which she was already, basically in a menopause. And after a talk with one of our experts, we recommended one of our partners from UK, and she went into the HRT. And after only, I think this was not even 1 year, this was basically within a couple of months, her biological age was reduced from 59 to 35 years, simply by going to the HRT. This is not only working on women. So even though women experience a sharp uptick at their menopause, men also have reduced levels of sex hormones throughout their life. And what we saw is that also for men, hormone optimization works, and their biological, in fact, decreased through the HRT. And we also have one clinic in New York with whom we're collaborating, and who showed a really, really great results. So to conclude this, sex hormones undoubtedly affect glycans, and glycan determine biological age. What we're developing is so-called menopause, so IgG glycan test that could be used as biomarker to determine long-term effects of sex hormones in perimenopause. So as you can imagine, we can compare it, for instance, to HbA1c in diabetes. So glucose would be measuring just the daily variations of glucose, and HbA1c would be measuring the levels of glucose within the last several weeks, right? And the same is with IgG glycans and hormones. So hormones have daily fluctuations. However, because of the lifetime of IgG, that is more than 3 weeks, IgG glycans are actually measuring what was the average level of the effect of the hormones on IgG glycans throughout the last couple of weeks. And what we're doing now is we're working with these discoveries, and we're trying to use IgG glycans in hormone optimization, because we saw that the most dramatic improvement of one's biological age has been through hormone optimization. And we have clinical trials and multiple scientific studies ongoing to further, explore this path. And we're open for collaborations for anyone who is working in this field. So with this, I would like to end my presentation